Hi everyone and welcome. I'm so glad you're here with me today. Now, how many of you have a medicine cabinet that looks a little bit, well, full? It's easy, isn't it? A little ache here, a sniffle there, and before you know it, you've got a collection of over-the-counter medications that rival a small pharmacy. I know I've been there myself, but here's something to think about. Are all those medications really helping us? Or could some of them actually be doing more harm than good, especially as we get a little older? That's what we're going to talk about today. As we age, our bodies change. The way we process medications changes too. What might have been perfectly safe and effective for us in our 30s or 40s can have very different, sometimes even dangerous, effects after 60. Our kidneys and livers, which are responsible for filtering out medications, might not be working as efficiently as they used to. And we might be taking other prescription medications that could interact negatively with over-the-counter remedies. I want you to feel empowered to take control of your health, and that starts with understanding what you're putting into your body. This isn't about scaring you. It's about informing you. It's about making sure you have the knowledge you need to make the best choices for your well-being. Think of it as spring cleaning for your medicine cabinet, a chance to get rid of anything that's not serving you anymore and replace it with safer, more effective alternatives. In this video, we're going to uncover 3 common over-the-counter medications that many seniors should be cautious about. Medications you might even have in your cabinet right now. We'll talk about why they can be problematic, and most importantly, we'll discuss some safer alternatives you can consider. We're not doctors, of course, so this isn't medical advice, and it's always essential to talk to your own healthcare provider before making any changes to your medication routine. But hopefully, this video will give you a great starting point for that conversation. Ready to get started? All right, let's dive right in. The first medication we're going to talk about is antihistamines. Now, you might be thinking, antihistamines, what's wrong with those? I take them all the time for my allergies. And it's true, antihistamines are incredibly common. They're used to treat everything from seasonal allergies and hay fever to insect bites and even the common cold. They work by blocking histamine, a chemical your body releases in response to allergens. Histamine is what causes those familiar allergy symptoms like sneezing, runny nose, and itchy eyes. However, many over-the-counter antihistamines, particularly the older, first-generation ones like diphenhydramine, Benadryl is a very common brand name, and chlorpheniramine chlorotrimeton, can pose significant risks for seniors. The biggest culprit, their anticholinergic effects. Anticholinergic effects basically mean that these medications block the action of acetylcholine, a neurotransmitter that plays a crucial role in many bodily functions. Think of acetylcholine as a messenger that helps your brain and your body communicate effectively. When that communication is disrupted, you can experience a range of side effects. For seniors, these anticholinergic effects can be particularly problematic. One of the most common side effects is drowsiness. Now, feeling a little sleepy might not seem like a big deal, but for older adults, it can significantly increase the risk of falls. Falls are a leading cause of injury and hospitalization in seniors, and anything that impairs alertness and balance can make you more susceptible. Imagine feeling a bit unsteady on your feet already, and then add in the drowsiness from an antihistamine. It's a recipe for disaster. But the problems don't stop there. Anticholinergic antihistamines can also cause dry mouth, blurred vision, constipation, and difficulty urinating. These side effects can be incredibly uncomfortable and can even exacerbate existing health conditions. For example, if you already have problems with constipation, an antihistamine can make it even worse. And if you have glaucoma, The blurred vision caused by these medications can be particularly dangerous. Perhaps even more concerning is the potential link between long-term use of anticholinergic medications and cognitive decline. Studies have suggested that these medications may increase the risk of dementia and Alzheimer's disease. While more research is needed to fully understand the connection, it's definitely something to be aware of, especially if you're already concerned about memory loss. So, what are the alternatives? Well, the good news is that there are newer, second-generation antihistamines available that have fewer anticholinergic effects. These include medications like loratadine Claritin, cetirizine Zeotec, and fexofenadine Allegra. While they can still cause some drowsiness in some people, it's generally much less pronounced than with the older antihistamines. Of course, the best approach is always to try to manage your allergies without medication whenever possible. Things like using a saline nasal spray to clear your nasal passages, avoiding known allergens, and using an air purifier can all help to reduce your allergy symptoms. And remember, always talk to your doctor or pharmacist before starting any new medication, even if it's over the counter. They can help you choose the safest and most effective option for your individual needs and health conditions. Now, let's move on to the second potentially dangerous over-the-counter medication, non-steroidal anti-inflammatory drugs, or NSAIDs, as they're often called. You probably know them by names like ibuprofen, Advil, Motrin, and naproxen, Alev. So, NSAIDs, ibuprofen and naproxen, are incredibly popular for relieving pain and reducing inflammation. They're used for everything from headaches and muscle aches to arthritis and menstrual cramps. They work by blocking the production of prostaglandins, chemicals that contribute to pain and inflammation in the body, and they can be incredibly effective at providing relief. I know I've reached for them myself on occasion. However, just like with antihistamines, NSAIDs can pose significant risks for seniors, especially with long-term or frequent use. The biggest concern here is the risk of gastrointestinal problems. NSAIDs can irritate the lining of the stomach and intestines, leading to ulcers, bleeding, and even perforation a hole in the stomach or intestinal wall. As we get older, our stomach lining naturally becomes thinner and more fragile, making us more susceptible to these types of problems. And if you're already taking other medications that can irritate the stomach, like aspirin or blood thinners, the risk is even higher. I've seen firsthand the complications these can cause, and it's not something to take lightly. Symptoms of gastrointestinal problems caused by NSAIDs can include stomach pain, heartburn, nausea, vomiting, and black, tarry stools, which can indicate bleeding in the digestive tract. If you experience any of these symptoms while taking NSAIDs, it's crucial to stop taking the medication and see your doctor right away. But the risks of NSAIDs don't stop at the stomach. They can also increase your risk of cardiovascular problems, such as heart attack and stroke. NSAIDs can raise blood pressure, which puts extra strain on your heart, and they can also interfere with the effectiveness of certain blood pressure medications. For seniors who already have heart conditions or risk factors for heart disease, such as high blood pressure or high cholesterol, the risks of NSAIDs can outweigh the benefits. It's important to have a frank discussion with your doctor about the potential risks and benefits before taking these medications. Kidney problems are another concern with NSAIDs, particularly in older adults. As we age, our kidneys become less efficient at filtering waste from the blood. NSAIDs can further reduce kidney function, leading to fluid retention, swelling, and even kidney failure in severe cases. If you have pre-existing kidney problems, it's especially important to be cautious with NSAIDs. So, what are the alternatives to NSAIDs for pain relief? Well, The first thing to consider is non-medication approaches. Things like heat or ice packs, gentle stretching, physical therapy, and massage can often provide significant pain relief without the risks associated with NSAIDs. For mild to moderate pain, acetaminophen Tylenol is often a safer alternative than NSAIDs. Acetaminophen doesn't have the same gastrointestinal or cardiovascular risks as NSAIDs, but it's important to use it cautiously and follow the recommended dosage. Taking too much acetaminophen can damage your liver. If you need stronger pain relief, your doctor may be able to prescribe other types of pain medications that are safer for seniors, such as opioid pain relievers. However, these medications also have their own risks and side effects, so it's important to use them carefully and under the guidance of a doctor. They are generally not a first-line treatment, and your doctor will want to explore all other options first. Ultimately, the best approach to pain management is a comprehensive one that combines non-medication approaches with medication when necessary, under the guidance of your doctor. It's about finding the right balance that provides effective pain relief while minimizing the risks. It's about listening to your body, understanding your individual needs, and working closely with your healthcare team to develop a personalized pain management plan. Don't hesitate to ask questions, express your concerns, and be an active participant in your own care. Now, let's move on to the third and final, over-the-counter medication we're going to discuss today: decongestants containing pseudoephedrine or phenylephrine. You'll find these in many cold and sinus medications like Sudafed, although some Sudafed now uses phenylephrine, and many multi-symptom cold remedies. Decongestants are those medications we often reach for when we have a stuffy nose or sinus congestion. They work by constricting the blood vessels in your nasal passages, which helps to reduce swelling and clear up congestion. And let's face it, when you can't breathe properly, that relief can feel pretty amazing. However, like the other medications we've discussed, decongestants containing pseudoephedrine or phenylephrine can pose significant risks for seniors, particularly those with certain health conditions. The main concern here is their effect on blood pressure and heart rate. These decongestants can raise blood pressure and increase heart rate, which can be dangerous for people with high blood pressure, heart disease, or an irregular heartbeat. They can also interfere with the effectiveness of blood pressure medications, making it harder to control your blood pressure. It's like they're adding extra stress to your already hardworking heart, and that's something we want to avoid. For seniors who have these conditions, taking decongestants can increase the risk of serious cardiovascular events, such as heart attack or stroke. And even for those without pre-existing heart conditions, these medications can still cause unpleasant side effects like anxiety, nervousness, and insomnia. Nobody wants to feel jittery and unable to sleep when they're already feeling under the weather. Another potential concern with decongestants is their effect on prostate enlargement, or benign prostatic hyperplasia, BPH, which is common in older men. Decongestants can tighten the muscles around the prostate, making it difficult to urinate. This can be particularly problematic for men who already have urinary problems due to BPH. Imagine trying to get relief from a stuffy nose only to find yourself struggling with another uncomfortable issue. Not ideal. So, what are the alternatives to decongestants for clearing up a stuffy nose? Well, fortunately, there are several safer options available. Saline nasal sprays are a great first-line treatment. They help to moisturize your nasal passages and loosen up congestion without the risks associated with decongestants. You can even make your own saline solution at home with just salt and water. Another option is using a humidifier or vaporizer to add moisture to the air. This can help to thin out mucus and make it easier to breathe. Taking a steamy shower can also provide temporary relief from congestion. I personally find a warm shower incredibly soothing when I'm feeling congested. For more stubborn congestion, you might consider using a nasal rinse, such as a neti pot. These rinses use a saline solution to flush out your nasal passages and clear away mucus. It might seem a little strange at first, but many people find them to be very effective. Just be sure to use distilled or sterile water to avoid introducing bacteria into your sinuses. And of course, staying well hydrated is crucial for clearing up congestion. Drinking plenty of fluids helps to thin out mucus and make it easier to cough up. So, keep a water bottle handy and sip on it throughout the day. Ultimately, the best approach to managing nasal congestion is to focus on gentle, non-medication approaches whenever possible. And if you do need to use a medication, talk to your doctor or pharmacist about safer alternatives to decongestants containing pseudoephedrine or phenylephrine. They can help you choose the best option for your individual needs and health conditions. So, there you have it, 3 common over-the-counter medications that seniors should be cautious about: antihistamines, NSAIDs, and decongestants. Remember, this isn't about saying you can never take these medications. It's about being aware of the potential risks and making informed decisions about your health. We covered that older antihistamines like Benadryl can cause drowsiness, dry mouth, and potentially increase the risk of cognitive decline. We also discussed how NSAIDs like ibuprofen and naproxen can irritate the stomach, increase the risk of heart problems, and damage the kidneys. And finally, we talked about how decongestants containing pseudoephedrine or phenylephrine can raise blood pressure and interfere with certain medications. The key takeaway here is that as we age, our bodies become more sensitive to the effects of medications. What might have been perfectly safe for us in our younger years can have very different effects later in life. It's so important to be proactive about your health, to ask questions, and to work closely with your doctor or pharmacist to ensure that you're taking the safest and most effective medications for your individual needs. They are your partners in health, and their expertise is invaluable. I really hope this video has been helpful for you. I know that navigating the world of medications can be confusing and overwhelming, but I believe that with the right information and support, you can make informed decisions that will help you stay healthy and active for years to come. Remember, knowledge is power. Don't be afraid to ask questions, do your research, and advocate for your own health. Small changes can make a big difference in your overall well-being. It's never too late to start taking better care of yourself. You deserve to feel your best, and you have the power to make it happen. Now, I'd love to hear from you. Do you have any experiences with these medications? Have you found any safer alternatives that work well for you? Share your thoughts and experiences in the comments below. Let's learn from each other and support each other on our journey to better health. And if you found this video helpful, please give it a like and subscribe to my channel for more helpful content on healthy aging. Your support helps me to continue creating videos like this one. Thanks so much for watching, and here's to living your best and healthiest life, no matter your age. Take care, and I'll see you in the next video.